Well, Prime Minister Justin Trudeau has made his healthcare transfer offer to the provinces. Now the ball is in the court of the provinces and territories. So Ottawa is prepared to increase federal healthcare transfers to almost $200 billion over the next decade, but the premiers are still looking for more. Let's break this down for you. About a quarter of the $196 billion is new money. A quarter of that $196 is new money. Trudeau says it will include an immediate and unconditional top-up of $2 billion to the Canada Health Transfer to ease the intense pressure on hospitals. Trudeau says one-on-one agreements can be flexible, but provinces will have to show plans for how they'll spend the money and how they will measure progress in those areas.
I know for a fact that a number of the premiers are looking at these billions of dollars that we're willing to put on the table to invest in improvements in healthcare systems, and we'll be moving quickly on this. Canadians know that we do best as a country when different orders of government roll up our sleeves and work together to deliver the right results for Canadians. Canadians need access to family doctors. Canadians need better and quicker mental health services, particularly for young people or people struggling with addictions and substance abuse issues.
And CTV News political commentator Scott Reid joins us live this morning from Ottawa with his insight into this massive overhaul of healthcare in Canada. Massive is the descriptor, Scott, but a lot of people are saying, a lot of premiers that is, are saying, you know, that 25% of this is only new money, not necessarily enough. They describe it as a start, as a down payment. What's your take on what unfolded in Ottawa yesterday then?
I thought that the base funding for, the CHT, which is the fundamental health transfer, was a little lower than, than I expected. But talking to a couple of premiers last night, I happened to see it was in line with what their expectation was for the federal offer. So I don't think you're going to see any kind of big kerfuffle where people are going to say, well, my God, we got hooked. This is bad faith negotiation. Do you think there's going to be a lot of negotiation? The Prime Minister's office is clearly trying to push the provinces toward bilateral deals where they negotiate for more money, jurisdiction by jurisdiction. And the reason, Nick, is that avoids one big 13-on-1 gang up from the provinces and territories on Ottawa. And that's, you'd rather have one-on-one negotiations with 13 than a 13-on-1 gang up.
Which is frequently what we see with the Council of the Federation kind of ganging up on whoever the Prime Minister is. But how difficult, Scott, and you know this, you've been in the PMO's office, of course, with Paul Martin at the time. How difficult is it negotiating 13 separate agreements? That seems like an enormous amount of work, too.
It's a lot of work, but in a lot of ways, it's a lot less political risk because you can move to Ontario, where things appear to be in very good shape in terms of negotiations. Say, let's focus on, say, long-term care. And then you can move to Newfoundland, where they're saying, well, and I saw the Newfoundland Premier last night, and he was like, look, I'm happy with this amount of money. If we can just really focus on, docs and trying to get people with a GP in their communities, then that'll satisfy him. So you can sort of pick off one by one. You ultimately, this is about improving the healthcare system. But from a negotiation standpoint, divide and conquer is the name of the game. You don't want to be ganged up on. And by having all these bilateral negotiations, you really do diminish your risk to having what looks like a failure.
And Scott, really quickly, got about 30 seconds left. What is the political risk here for the Prime Minister in terms of we're in a minority situation? Most of these premiers are sort of, dug in. But what's the concern here? If he can't get sort of the premiers on side, how vulnerable is Trudeau?
I don't think too vulnerable, and I think he does have them on side. They're going to take the money. Healthcare is straining. They need those billions, so I think they'll take the money. They may come with some complaints from some, but I don't think it's going to put his government at risk in terms of being forced into an election. I just don't see that in the cards.
Okay, good to hear. That is CTV's political commentator, Scott Reid, joining us live from Ottawa this morning. Always appreciate the analysis. Thanks, Scott.